Yeah, good morning. It's another Monday, and good to be with you today on Summit, the program that comes to you live from our studios here in Lagos. And I assure you that on the program, you always get apt information on everything that is happening both nationally and internationally. My name is Jumoke Michaels. Banji is also here bright and early. Banji,
Jumoke,
good morning.
Good morning.
Good morning.
I asked you over the weekend how you're coping with the lockdown. Now, I asked you whether it was not boring, staying at home, spending more than the usual or the normal hours with your family.
Well, I don't want to tell you what I actually did on Saturday, but let's leave that. But aside that, well, we are coping nicely.
Yeah, for us in Lagos, this is the end of the first week, the first of the 2 weeks of the lockdown. By the end of today, we would have actually ended the first week. So that will be going into the second week. But how well have people complied? How well have people actually obeyed the instructions, the directives of the various governments to stay at home? It's one of the issues we are actually going to look at on today's edition of the program. For me, I've tried as much as possible to just follow the instructions strictly. That is, I stay at home when I don't have any reasons to be in the studio or to do my work as a media man, as a journalist. My name is Banji Busari. I'm glad to be here.
Yes, thank God you mentioned the issue of how much people are actually complying to the lockdown. Today, I would like the authorities to know that the compliance today is quite low. The street is full of people. The street is full of transporters. So they need to do something about that. You mentioned your area too, that you were surprised this morning that
the Marwa,
the Keke driver were already on the road.
They're on the road. Keke Napep, that's, I can give it to you free of charge. The Keke Napep between Command, Secondary School, Ipaja, and Abuli Egba, of course, they are doing their trade the normal way. Same for Okada. I mean, having brisk business, making money here and there. Of course, maybe they are tired, maybe they have nothing to eat. Whatever the reasons are, I don't think it's acceptable. And I think government has to actually wake up. I'm also aware that Yanoiba, that's on your way to Badagry and all that. That place too, the transporters are back at work. Same for Jodubega here. They are back at work. So the compliance level cannot be more than maybe 60 to 70% as we speak.
Yeah. All right. So today on the program, we're still going to be talking about the COVID-19 because that's just the information everyone needs to have at this time. And so we'll be getting some updates from our guests with us in the studio. And also on the program today, we'll be looking at the issue of the
stimulus
package. Yeah, the stimulus package. How is it really being distributed in Lagos? And then when we get to that discussion, we would like people to call in. Even CDA chairman would like to hear from you how it actually went in your own local government area and CDA. Would like to have apt information on how it was actually distributed. Did you get enough? Can you really get enough for 200,000?
Did they get as much as was promised?
As much as was promised in each area. Would like to get those informations. And well, if you got an alert, too, because I don't know, people are saying whether they got alert or they didn't get an alert from the government. If you have been duped, you can also let us know so that you can warn other people to take up accurate precautions. Today, joining us on the program, again, we have Dr. Japhet Olugbogi. Olugbogi is the chairman NMA Lagos Committee on COVID-19. You're welcome, Doctor.
Thank you.
Olugbogi, let me just quickly change it now.
You were actually here last Wednesday, that's a couple of days ago. That's second day of the lockdown. And the lockdown, I want to believe from what you told us on Wednesday, was to actually stem the tide of the spread. Yes. Now, and then for you to be able to catch up. Now, this lockdown in 6 or 7 days now, how effective do you think it has been, and what has been the level of success with the curtailing or curbing of COVID-19 by your team?
Thank you very much, Banji and Jumoke. The first few days of the lockdown, was almost absolute lockdown, as we expected and yearned for. But like you rightly mentioned, people are beginning to come out for whatever reasons. Maybe they are bored, maybe some people are hungry, some people just want to come out. So what we want is absolute lockdown. What will help us is absolute lockdown. So far, in the past 7 days, we've recorded some measure of success, which I can't even begin to quantify on screen. But we've been able to clear the backlog of tests, samples that we had, and we've also been able to test more patients, more people whom we have collected their samples. And as the days go by, we are testing more people. We are collecting more samples from people. We are testing more people now. Today, one of the reasons why I woke up very early today was because we started what we call active case search today. And I needed to speak with my team and then...
What do you mean by active case search?
Yes, active case search is the next phase of what we want to do. And that, after mopping up the cases in the community, in the areas where there are largely reported positive cases of COVID-19, what we want to do is go from house to house, from one PPMV, that is a patent medicine vendor, to another, from one hospital to another, from one TBA to another, where we can find out how many people in the past few weeks, in the past couple of weeks, have complained of fever, cough, and breathlessness. So we want to see if there are cases out there that we may have missed, so that we can pick them up, collect samples from them, and then test them. That is what active case search is all about. So we'll be going from house to house, from household to household, to inquire about such symptoms. If that is not enough, we'll also be going from hospital to hospital to find out how many people have come to make such complaints. We're also aware that sometimes when some people are ill or sick, they don't go to the hospitals, and they go to the patent medicine vendors, the chemists. So we also visit a chemist shop to find out how many people around this area have come to buy drugs for cough or for fever and now when we find out all that, we will triage them and find out who actually have a respiratory tract infection or some other things that can actually cause cough and exclude COVID-19 symptoms, and then make sure that we are on top of the matter. So that is what active case search is about. And we have some form of scientific way of recording this so that we can also monitor from the state level and the national level, so that we can have a record of what those people are doing on the field. So there's a scientific method of recording that. So in the past 7 days, we have been able to bring in more people from the community who were actually either suspect, that is to say, we have not confirmed that they are COVID-19 positive, but they are showing signs and they have history of being in contact with somebody with COVID-19 or travel history. So we have been able to bring in more of them. I've been able to test more people. We have been able to follow up, more contacts. Many of the passengers of interest who came in from either UK, US, or what have you, that we were monitoring, many of them have fallen off the list now because they have exceeded their 14 days window period that we gave them. So we have been able to do all that. We have also been able to wrap up our contact tracing. Contacts are those who may have been in contact with those who actually tested positive. So the lockdown has been able to help us catch up with the virus, so to say. Because before, if you don't lock down, the virus will keep moving at a fast pace. And if you cannot catch up with the virus, then there will be a cluster of cases in the community, or even a full-blown community transmission. So that's what we've been able to achieve. And that's why we are praying the people, and we are urging the people, and then urging the government as well to ensure that the lockdown continues and is effective, not in the kind of scenario you were just painting. Yeah. You're right, because I actually drove past some areas, and we found out that people are beginning to troop out. Not even just the traders,
transporters,
even other people coming out. We heard of a party, which how many days ago here? Was it yesterday or a day yesterday? Such things, what we are trying to prevent at this moment in time, so that we don't have a full-blown community transmission on our hands.
But
that doesn't happen. If that happens, it's a whole lot of work for us to do.
All right, but these scenario you painted now, or some other plans you mentioned now, that's about going from house to house and they make inquiries. You make it sound like this thing is still serious.
Yes.
And we still have people who, number one, they are still acting in disbelief. Number two, some are still nonchalant. Number three, some are still just not bothered, you know, about keeping this social distancing we talk about. But you are painting the picture of like there's still so much to do.
Yes, thank you, Jumoke. It is absolutely serious. If we say it's not serious, we are deceiving ourselves. Although we are trying not to scare people, not to frighten people, but it's absolutely serious. It's a serious work. A lot of people are losing sleep. A lot of people are losing, why some people are at home enjoying with their family, enjoying the lockdown. A lot of us are not at home with our families because we are running a task to make sure that things that we need to put in place are put in place, things that we need to do are done at the right time, so that we can curb the virus and then prevent it from, prevent it from getting to places like Alakuko, Agege, Badia, Ajegunle, Makoko, Alaba, Ajangbadi. So we are trying as much as possible to prevent this virus from getting to such places. So there's still a lot to be done. It's not yet Uhuru.
It's not yet Uhuru. So we may not be able to put a figure, or should we start looking at whether the lockdown has resulted in the number of reduction in the number of infected people, or how? How can we begin to assess?
Absolutely. I cannot put a figure to it, but obviously the lockdown that's what it's supposed to prevent, and I can reassure you that it has prevented the number of cases that are spreading. You can say no, because you guys have been giving us more figures per day since the lockdown. Yes, we have been giving out more figures, and that's because we are testing more. We are testing more people than we used to. We now have 3 test centers in Lagos. That means that affords us the opportunity to test as many people per day as possible. We are testing about 250, 300 now, and I'm sure the figure will keep on increasing. So the more people we test, amongst those who have been in contact with those who have been positive, the likelihood of the chances that we get more people. So the fact that we are getting more cases in the past 1 week does not mean that the infection has spread more. No. Okay, imagine those who are testing positive now. Imagine if there was no lockdown and they were having parties, having one function or the other, going to Uwambes. Yeah. You can imagine what would have happened. It will have skyrocketed by now. The numbers will have gone into the thousands by now. So the lockdown has actually helped achieve some form of break in transmission as much as possible.
Well, we're halfway into the lockdown now. At the expiration of 2 weeks, would you be able to conclude convincingly that you've succeeded in testing everybody and people can go back to work?
It's hard to say right now because efforts are ongoing, and like you rightly said, a lot of people are not obeying the lockdown. So it's hard to say that by the end of the 2 weeks we'll have been able to achieve all we want to achieve. Although efforts is ongoing, we know, we are aware in other countries their lockdown is more than 2 weeks, lockdown is more than a week, some are even up to a month now. So if need be, we may need to increase the lockdown. But let's even have the 2 weeks, and we will review as soon as the 2 weeks is almost over. We will review and see where we are and see what more do we need to do and what more do we need to put in place. What more actions do we need to carry out? Reviews are ongoing. Like I told you the last time I was here, there is an emergency operation center meeting every day. So these meetings, they review the resources that have been put in, they review the activities that have been done in the previous days, and they also chart the way forward for what needs to be done the following day or in the following weeks to come. So we will review as the lockdown goes on, and then we will see if there are other avenues or what other measures that we need to take if the lockdown needs to persist. But don't forget also that the lockdown we are having is not a total lockdown, per se, because for certain reasons, the government relaxed the lockdown a little.
Yeah.
Some people can come out now and open their market between 10 and 2 p.m. And then we have the shops and the stores that are opening between, 10 to 4 p.m. So this affords the opportunity for people to break the social distancing rule that we were trying to preach at the initial stage. But then again, we know that people need to feed, people need to eat. So the government is trying to marry these two in pari passu and make sure that we don't have a break of law on our hands. For instance, if you pass through some areas at night or even during the afternoon, you will see boys that will be hailing you, Baba, give us something to eat. So if you don't add tact to it, these kind of boys can, in the night, end up trying to force their way into making a living and all that. So government is trying to marry the two together, but we will encourage that we try as much as possible to achieve a total lockdown so that we can prevent the virus getting fully into the community, because it's already in the community. That's why we are having more cases.
Okay, tell us.
Okay, yes, I want to say that with the way the medical personnel are working really hard,
Yes.
now the government says it wants to bring in Chinese doctors, and the enemy is kicking against it, that there's no need to bring in Chinese doctors. What's your reaction to that?
Well, my reaction would be the reaction of the Nigerian Medical Association. You see, there's a press release to that effect, and the feeling is such that if you have a father who has children, and you ask the children to manage a company, and they are doing well, they're managing the company well, and instead of giving them maybe 10,000 to manage the company, you are giving them 4,000 or 3,000 to manage the company, and now you just all of a sudden tell them you're bringing experts from somewhere else to come and manage the company. What do you think will happen to their morale? Their morale will come down. First of all, why don't you give them all the necessary things they need? Give them all the necessary personal protective equipment, bring in ventilators, bring in machines, build isolation centers all over the country. We know so many states have not put in place isolation centers. And those who have done that, they have not put in place a befitting isolation center. They have not put in place ICUs. We need intensive care units. So if our experts here, who are already doing well on the mega resources they have, can have the full backing of the federal government, I'm sure they can achieve more.
And that's the challenge we've been having over time.
And, challenge we've been having
and we are still making that same mistake.
I believe that the federal government should seize this opportunity to improve fully the healthcare system that we have in Nigeria right now, rather than thinking of bringing in experts. The experts they're going to bring, they probably put them in a 5-star hotel, they probably mobilize them, they probably spend a lot of money trying to take care of them.
Yeah.
Now, how much would 18-man team do in Nigeria? Are we going to put the 18 of them in Lagos? Are we going to put the 18 of them in Abuja? Are we going to split them into states? How effective can that be? We have experts here who are doing very fine. We are discharging cases. Yes, we have recorded 5 deaths, but those 5 deaths, we are all aware that they have comorbidities. That is, they have some diseases, some ailments that were in their body before. Those who have had COVID-19 in Nigeria are actually recovering. That means the healthcare system is working. That means the medical experts here, they are working. They are doing something fine. So why don't you just give them support, as much support that you can give them? How many ventilators do we have in Lagos? How many ventilators do we have in those isolation centers? If government is bringing ventilators from China, from Italy, from anywhere, then the NMA will be happy. The medical system will be very happy with them. So what we need to do is support.
You do not think there's any experience they have that the enemy can share from?
Yeah,
in the government's wisdom, it may have been a case of not trying to reinvent the wheel. I mean, China has been the epicenter of
but they are still having cases.
They succeeded in actually pegging it to a particular point.
They are
for
pegging
so
it,
many.
but they still have issues.
So
they are still dealing
if
with.
they have such very robust experience in curtailing it, do you not think there's anything you can share?
Of course, I personally can gain experience from whatever experience they are bringing in. But don't you think it is not the right time right now to bring in experts from all over the world? We don't even have, we cannot say right now that we have up to 3 ICUs, intensive care units, where you have all the gadgets set up. If these Chinese experts are bringing in ventilators, monitors, oxygen tanks, and commodities, it will be very nice to have them. If they're bringing expertry, they can teleconference and give us information. We have experts here in Nigeria who were sent by WHO, even NCDC themselves, even African CDC, who are doing very fine. They are doing very, very fine, if you ask me, from personal experience. So we can continue using their expertise, but Chinese men coming into Nigeria, in fact, it will also even be said that it was when, well, I don't know, I can't substantiate that, it was when the Chinese experts got into Italy, that there are a number of cases started boomeranging. So,
let's hang it there. Let's hang it there. You can ask them.
Yes, still on the issue of contact tracing. There's this issue we heard about in Louth of a family who brought someone who was sick, but they weren't given the doctors there correct information about the health status of the sick man. And then he eventually died, and it was discovered he actually had COVID-19. And they abandoned the body and ran away. Could you update us on that happening?
It was an unfortunate incident. Once more, it asks a lot of questions about our social, cultural beliefs and practices. But I want to ask a quick question. If one of those doctors were a Chinese expert, and then they gave him false information like that, and he doesn't have the personal protective equipment to wear to protect himself and his colleagues, what would he have done in that instance? What would he have done better than our doctors in that instance? So what we are saying is that give us enough personal protective equipment, give us the enabling environment. Our doctors will actually perform wonders. They will do wonders. So back to the matter, it was gathered that the family did not disclose fully the nature of the illness to the doctors. They didn't disclose fully the travel history to the doctors, and then they treated the man like as if it were normal routine patient. And then at the end of the day, it was discovered that it was a COVID-19 positive case. It is very unfortunate because those doctors are now in isolation. Those are doctors who ought to be attending to other patients. So we are saying that we need more doctors. You want to bring in Chinese experts and all that. But the ones we have on ground, they are going into isolation because some people misled them. And then also put them at risk at the same time. I think it's not good enough. Also, permit me to also flash back. Are you aware that the hazard allowance of medical personnel in Nigeria is a meager 5,000 naira?
Per day or?
No, 5,000 naira per month.
What?
That's the hazard allowance. That is to say that if, God forbid, anything bad happens to a medical personnel while they are discharging their duties, the amount they received from the government for taking care of themselves, for ensuring that that hazard is taken care of, is just 5,000 naira.
But we have Lagos State government has put them on a health insurance or something. That was on Friday or Saturday.
Lagos State government is planning an insurance package for the health workers on the front line of this COVID-19 fight. But on a normal day, the normal salary, the normal emolument of the medical personnel in Nigeria, it is 5,000 naira, whether at the federal or state level. So tell me, what can 5,000 naira do? These are the kind of things that the NMA sees and feel that the government should not bring in any Chinese expert. If you have money to spend on them, spend the money on your own expert. Spend the money on your own personnel.
That point is well made. Let me ask you quickly because we do not seem to have enough time on it. 5G and coronavirus, what's the relationship?
Okay, let me come from this perspective. Please, what is the relationship between 4G or 3G and Ebola or Lassa fever? Can you tell us?
No, there's a wide speculation. No, there's a wide speculation that
yes, that's the word. That's the right word. Speculation.
Yeah,
I think it's just speculations.
Came to be.
I saw a video where somebody was trying to explain the relationship. But me, I'm not a pastor. I'm a scientist. I'm a medical personnel, and whatever we do is always backed by evidence. We practice what they call evidence-based medicine. So there's no evidence, there's no research, there's no study, there's no survey, there's absolutely no medical or scientific research to prove that 5G has anything to do. In fact, the thought of it, the sound of it is...
it makes you laugh, right?
Because, I mean, we had Ebola, and we still have Lassa fever. Don't forget that Lassa fever is still in Nigeria. It's still killing some people in some parts of the country. So what relationship can we say that have with, say, 3G or 2G or even 4G? What relationship do they have?
Okay, if Jumoke will permit me before we actually leave, in America today, the raging controversy is that there is a very, very high connection between the wearing of face mask and the reduction in the infected people in the US. So there is a kind of campaign for use of face masks. In fact, there's a comparison between Italy and South Korea, that the moment South Korea introduced face masks for all its citizens, the curve was actually flattened and the number started dropping. Now, last week on this program, you said face masks are meant for only health workers. Now, what's your position even with that controversy?
Thank you very much, Banji, for bringing that up. As it is, all the questions you have asked me today, this is the most difficult for me to answer. But I will look at it from this perspective. Last week, truly, on Wednesday, our campaign then was that individuals who are sick or who take care of health workers should be the ones to use face masks. But we are seeing a lot of developments in other parts of the world, like you rightly mentioned. And the WHO also is reviewing their stance, because what we do is according to WHO and NCDC criteria. So WHO also is reviewing their stance on the use of face masks. So immediately they say everybody uses face mask, I will like to come back here or go on any TV and tell people, please use face mask. But as it is right now, we are reviewing that decision. We are reviewing that position. And don't also forget that in Nigeria, we don't have enough face masks. We don't have enough of all these things. So immediately you tell people, please wear face masks, even those who need it. Those who do not need it will start wearing face masks everywhere. And then before you know it, how much is face mask? I asked for a pack of face masks this morning. It was 13,500. We used to buy that for 350 naira to 400 naira. So you can imagine the what dimension is that? What percentage increment
can afford it.
So in those countries you mentioned, they don't have that kind of exponential growth in the rate at which they sell their products. In fact, in many countries they will give you those products free of charge. But here we are hiking the prices. And it's one of the situations we have found ourselves. It's a very dire situation. Because if you look at it, the health workers are the ones that need to wear the face masks the most. Now, if we cannot afford it, if you cannot afford to give it to them, to buy as many as possible for them, it means that they are exposed to whoever comes to them. They are exposed to whoever patient they have, whichever the nature. But those who are actually supposed to be in their homes, resting, observing the lockdown, will now start, buying more of the face mask, and then you put more demand on the product. And
meanwhile, you can only use one per day.
Meanwhile, you should only use one. In medical practice, we use one per procedure. It's because the thing is now more expensive. So you should use one and discard it immediately you use it. Not even per day. You should use it and discard when you have a procedure.
I wish you had 2 hours to go. Sorry, we just have to let you.
Thank you so much, Dr.
Thank you very much, Dr. Olugbogi.
You are welcome.
for being a part of the program. Wish you all the best.
Thank you very much.
Thank you so much. All right, we'll continue with the program with an
With
interview.
our package, yes.
Yeah, with a package that we did on food distribution, who is getting it and who is not getting it. So we'd just like you to see that package, and then when we return, you can send us your messages before we end the program. Stay with us.
200,000 indigent families that consist of the vulnerable, the elderly, the physically challenged. So these are the people we are catering to, not that we are, like 200,000 households of every and anybody in Lagos. So people have to understand. And in terms of the preparation, as you can well see at our facility here where we are doing the rebagging of items, we are rebagging rice, 5 kilo packs. We are also having Gary, 5 kilo 3 kilo. We have pepper mix, and then we have two loaves of bread that we are giving as a package for a household. And as you can see, this entails the coordination of a lot of people, a lot of players in the supply chain and logistics sector, if I may use that word. You have the truck, the transporters, you have the procurement aspect where you have to buy some of these items. You have those that are helping us to package, and then you also have the security team on ground that we have to use to help us in terms of moving the items from base to the different local governments. So it's actually a coordination, a cooperation of so many people doing different things just to ensure that we're able to deliver on this palliative measure to the people of Lagos. So in terms of the structure we have on ground, it's to use the CDA, CDCs, to use the religious leaders we have on ground, to have also a mix of the counselors in there to help us, because these are the people that can reach these people we need to target at the grassroots level. And in terms of the success rate, I would say it's relative. In some local governments, it's been quite successful. In some other local governments, we've had a few hitches here and there. But I think we need to also put into consideration that localities to localities, we have differences in terms of the people, the composition. So we need to take that into consideration as well. But by and large, like I said, it's relative. Some local government has been very successful. Some, we've had a few hitches, which I will not run away from. I would say that at least we've been able to touch about 70,000 indigent families. At least that is what it's supposed to be, about 70,000. We are still working. We have not stopped. We are here 24/7. We have people here 24/7 to ensure that packaging goes on. And this is not the only facility we have doing that. There are other facilities out there. We are churning things out at a faster rate than ever before. We've engaged the services of some manufacturing companies as well to help us, because they would have the equipment to seal these items to rebag faster than even what we can do here. So we want to ensure that at least in the shortest possible amount of time, we're able to reach the 200,000 people, 200,000 families, indigent families that we have said that we would. And like Mr. Governor had said, this is just the first step or the first phase of the palliative measure. We don't know how long this pandemic and this situation is going to last for. So depending on how the situation goes, whether it improves, then we will know the next steps to take. Okay, so in terms of the feedback, I think the narrative here should be that either the CDAs are not fully informed about what this palliative or who this palliative is meant for. Because if you as a CDA officer, you receive some packs of food items, the idea is the CDA is supposed to help us identify the elderly in the community, the physically challenged in that locality, to give the particular food items to. If we have to say that we'll feed the entire Lagos, I think that we will not be doing ourselves justice. 200,000 households is equivalent to 1.2 million people out of a population of over 22 million people. So it's not like we are going to be giving a bag to every single household we encounter. It's just to identify those physically challenged, the poor in our midst, and give those bags to them. So when a CDA official receives maybe 3, 4, 5, I don't know what the quantity may be, but whatever quantity that person receives, it's not meant for everyone in that locality. It's just for him to identify those people that I have mentioned who constitute the vulnerable and give those food packages to them, rather than receiving the bags and then they start to open the bags and then they start to scoop out and start to share the bags among so many. That is not the idea.
The CDC have taken the relief package from the state government. We have over 285 CDAs. It gets to all the CDAs in our local government. It was divided according to the various joint CDAs, the number of CDAs in each of the joint CDAs, and it went round. I've been calling them and I've been receiving various pictures of those needy who got the relief package. At least Agbado Okeodo got over 1,000 of the relief package, and it is divided accordingly. In the near future, we should be able to provide more, because definitely 200,000 families out of over 20 million population. We thank him, but he has to do more in the near future. My advice for them is to please be patient with the government. This is a new approach or something that is happening to us for the first time, and the government is responding to it. In the near future, the case won't be like this.
I want to believe that the state government really tried their possible best, because when you see what happened, you know, nobody expected what really and it needs a lot of urgency. That is why Lagos State and federal government then jump into the action. And with what they did now, I want to believe they really tried, because they promised that at least they will provide food for 200,000 households, in which I believe part of it are being moved to this local government. And as Agbado Okeodo, CDC, ESCO, we received our own part, and it has been distributed to the various joint CDA. I just want to advise that no matter the case may be, we are expecting more from both the federal government and the state government, so that for those people that are yet to receive part of this benefit, so that it will get to them maybe through the second batch that is coming to Lagos State. I just want to advise all the community. You know, government cannot satisfy everybody. It is not easy. But with what government has done, that is to tell us that they are they have interest in Lagos State citizen.
All right, so that's the package. Let's introduce, we have someone on the line. Hello.
Hello?
Hello, good afternoon.
Yes, this is your own segment, and for residents of Lagos State, the purpose of this segment is actually to review the recent distribution of stimulus package promised by His Excellency, that's Governor Sanwo-Olu of Lagos State, that's targeting 200,000 families. Yes, the distribution has actually taken place. We'd like to know the CDAs,
Hello?
the CDCs,
Okay.
how well.
We still have him on the line. Hello?
Hello, good afternoon.
Yeah,
Good
good
morning.
afternoon. Yeah, good afternoon. Yeah,
Yes,
Yeah,
so
I'm Apostle Oshinobi.
Apostle Oshinobi.
Yes,
Yeah, where are you calling from, sir?
I'm calling from Agodo Egbe, Elegbe.
Now, are you the chairman or are you a member of the ESCO?
I'm a secretary to CPA.
Okay, so tell us your experience with the stimulus package promised by Governor Sanwo-Olu. Did you get your CDA?
Yes, it's got to our CDA. We were given 3 bags of stimulus containing rice, beans, and pepper something, and 3 loaves of bread.
3 packs of the package.
The package, yes, with 3 loaves of bread.
Now, how many households do you have in your CDA?
Under my CDA, we have 420 houses.
Now, tell us, give us,
16 streets.
give us an idea of the number of vulnerable individuals within your LCDA, within your CDA rather.
If I should count by street, I think we should have over, say, 10 on each street. About 160. 160 vulnerable.
160.
160 vulnerable individuals in your CDA. Whereas you got 3. So how did you handle it?
We only managed to give 3 high-class vulnerable. I call it high-class. Those in their 90s, 85, and those who have stroke, bedridden. So those were the 3 we gave.
So the remaining ones, there was nothing you could do about it.
There's nothing, but I was privileged I scripted something on the Facebook, and the special advisor to the governor on agriculture, Mrs. Abisola Olusa, said for me through the commissioner of agriculture, Mr. Bola Olawa. I was with him yesterday in his office. He conducted me around on what they are doing. He spoke. We had an in-depth discussion, and I gave him my own suggestions way through. You see, when you announce you are giving the public or the people the food to cushion the 14 days and bringing 3 bags for it's ridiculous.
So
we discussed that length, and it says my letters are giving them an insight to improve and re-strategize on what they will do next. And he said that they have been getting a lot of consignments from individuals. So I am advocating that the blue sheets Lagos, it is Lagos they make their money. Let them contribute, let them bring that good money, millions, billions to Lagos State so that they can feed the negotiators. Negotiators are crying. They are the
Okay, Apostle Shinobi, let me quickly ask. Was there any intervention when you met the Honorable Commissioner of Agric and the Special Advisor? Was there anything they did? Was there any intervention?
I know he only gave me 20 bags.
Okay.
Okay.
That's apart from the 3 you got initially.
The visit.
Okay.
And the 20 bags I have distributed to the less vulnerable. I have the pictures with them. I took as I gave them the consignment. I took their picture. I took pictures with them. I am sending the pictures back to the commissioner as a feedback on my visit yesterday. I recommend the Lagos State government, the commissioner for Agric, let them keep the work and put more effort.
All right.
Thank you.
Thank you so much, sir. Yeah, thanks for calling.
Okay.
So that's the problem is really So the problem is that really that people feel that these things are not being done, but they are actually done. It's just that the number of people that they have to reach with this thing is really, really high. So that the distribution looks like it's non-existent, but it's really ongoing.
I think we'll appreciate more feedback from the people so that we can collate.
No, we cannot take any more feedback.
No, I mean, not today. I mean, subsequent editions,
All right.
we may have to actually ask people to tell us their experiences as a way of feedback. This is what government wants. How well was it handled? And then so that to help them at the next phase. Yeah,
but I really like this call because it further made it clear to people that government is actually doing something. It's just that more needed to be done because the number of the vulnerable or the poorest of the poor is actually higher than what the package can actually
what the government actually planned for.
Yes. All right, we'll see you again on Wednesday. I'm Jumoke Michaels. Bye-bye.
Thank you for being there all the way. My name is